Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and our topic today is food allergy facts. And joining us is Dr. Barry Alper. He's a board-certified allergist and consulting specialist at Fairmont Medical Center, part of Mayo Health System. Thanks for joining us today, Dr. Alper.
My pleasure. Glad to be here.
Well, before we get into the heart of today's topic, which is food allergies, let's talk about allergies in general. When should someone see an allergist?
Well, I think it's important to first know what an allergy is and recognize that what the problem is. Allergy refers to an adverse reaction to an exposure. It can be to an inhalant, pollen, dust, mold. It can be to insects, and it can certainly often be to food. However, all negative reactions are not necessarily allergies, and that's where an allergist can play a role in defining what the problem is.
So, should someone come directly to an allergist if they're having a reaction, or do they go to their family physician first, and then are they referred to you? How does that work?
I think both paths are acceptable. If a person is convinced they're reacting to something and wants to come into the office, we'd be more than happy to see them. It's also a good idea sometimes to check with your family doctor, your internist, or your pediatrician, and they can make a determination as to whether the individual should see an allergist and what measures need to be taken immediately.
Well, here in the Midwest, I think a lot of folks suffer from the type of allergies that you see in the spring, the summer, and the fall with trees and dust and weeds and that kind of thing. And I'm assuming you see a lot of that, right?
Well, I think that's an enormous problem here. Even though our growing season is short, pollen and mold counts can get extremely high and cause a great deal of problems. Some patients suffer from allergic rhinitis, common name being hay fever, and if that's very severe, or sometimes it can even develop into asthma.
And just to clear things up, hay fever is not a fever, right?
No, hay fever refers to the etiology of that word comes from the fact that it's most common in August and September. That's when ragweed pollinates, but it's also the time on the farm when hay was cut. So people naturally refer to it as hay fever.
Well, another thing that some folks are allergic to is actually food, and that's what we're here today to talk about. Tell us about food allergies, and how common are they?
Well, food allergies are very interesting. There's a lot of misconceptions. I think instead of calling all reactions to foods allergies, we should talk about them as adverse reactions. And from that point, then determine if they're allergic, if they're due to chemical properties, idiosyncratic properties of foods. So the cause of food reactions vary. A study done by the American Academy of Allergy showed that over 50% of people feel that they're allergic to some food, and in truth they do react to many foods, but often those reactions are just adverse reactions to properties of the foods and not necessarily immunologic. It's important to figure out exactly what's going on because dietary manipulations are difficult. They can have nutritional problems for individuals, and a lot of mistakes are made if we don't know whether it's an ingredient of the food or a chemical property of the food. So I think it's important to determine whether a person's having an adverse reaction due to allergy or not.
So the difference between adverse reaction and immunologic reaction, is there a very slight difference between the two? Or?
Well, for example, I see many patients many children are brought into the office where the moms may say the kid's allergic to milk. Milk allergy absolutely exists. And when we talk about milk allergy, we're talking about an IgE and a particular component of the immune system reacting to a protein in the milk. Many, many children, however, don't have milk allergy. They have a lactose intolerance. And that's not an allergy. It's an adverse reaction to the fact that there's a lack of lactase, an enzyme in the small intestine which digests milk. The symptoms of milk allergy and lactose intolerance may resemble each other, but there's a big difference in what you have to do about it. Milk allergies sometimes can have respiratory problems. A lactose intolerance will not. Both of them can cause diarrhea, abdominal discomfort, abdominal pain, But a lactose intolerance, you don't have to absolutely avoid all milk, and you just have to have a relative smaller quantity of milk that can be tolerated.
So what are some other forms of food allergies, or I guess that aren't food allergies, but folks, the misconception is that they are?
Well, I can just remember when my kids were younger, my daughters were insistent that they were allergic to all green food. And anytime you put a salad or a vegetable in front of them, they would vomit. And I think that was more of a psychological reaction as opposed to a food allergy. And so, there's many, many different reasons. People come into the office often and say they're allergic to coffee because they get palpitations. Well, that's a reaction to caffeine. Caffeine's a pressor. It causes an increase in blood pressure. It may increase heart rate and cause palpitations. But again, that's not an allergy. It's an adverse reaction to a component of the food. Allergies can be diagnosed by doing testing that's specific for allergy. You can do skin testing, you can do blood testing, and do different measures to make that diagnosis. And I think it's important to know whether an individual is having a allergic reaction or a non-allergic reaction to a food.
So if someone feels that they are allergic to a food and then you test them, find out that they are, what can be done?
The treatment for food allergy is very limited. The only thing that can be done for food allergy is avoidance. There's no drugs available today. There's no allergy shots available today to reverse allergies to particular foods. There are studies being undertaken now for peanut allergy, for instance, which has cataclysmic effects because it can cause respiratory distress, even result in death from inadvertent exposure. So studies are being done to try to desensitize patients who are allergic to peanut by giving them repetitive doses of peanuts. But that's really being done only on an experimental basis, and that treatment is not available. However, for peanut allergy, for instance, avoidance is recommended, but it's very difficult to do because peanut is camouflaged in many, many different foods. So you can go into a restaurant and order a salad. It could have peanuts or nuts sprinkled on it, and patients inadvertently are exposed. Cookies at school may have peanuts added to them, and kids aren't aware of that. So the only treatment besides avoidance is to keep something like an EpiPen available, which contains adrenaline, which can reverse severe life-threatening allergies to peanut. Some other foods can cause this as well. I mean, people can have very severe reactions to shellfish, to fish in general, even to milk or eggs. So if people are having severe respiratory problems from foods, we can't reverse it, but we can identify it and then take precautions so that it doesn't have disastrous outcomes.
And that's what my next question was for you. What are some of the telltale symptoms of food allergies? You talk about respiratory symptoms, but what kind of respiratory symptoms, and are there other symptoms too?
Well, I think there's a myriad of different reactions that you can have from foods. I think it's important first to look at the history in terms of the timing. Food allergies almost always happen quickly. So many patients start to develop symptoms as they're eating the meal or within minutes of eating the meal. Textbooks say that food reactions can occur up to 8 hours after exposure. In my experience, which is extensive now, I've been doing this for over 20 years, almost all food reactions occur within hours. And when patients come in and give me a history of reacting to a food they ate the day or 2 days before, I tend to discount it. Symptoms of food allergies can occur with just small quantities of food. So it's not a dose-related phenomenon. So it doesn't matter if somebody is allergic to peanuts or shrimp. They don't have to eat 1.5 pounds of peanuts to react. They'll react to small quantities, and then the reactions will cascade from that point. Initial symptoms often are oral, so people will have itching in their mouth. They may have swelling of their lip, swelling of their tongue. They may have skin reactions with urticaria, meaning diffuse hives, diffuse itching, swelling of their hands or feet. Respiratory reactions are the most severe. Those are the ones we're most concerned about, and they can involve tightness in the throat and difficulty breathing. I think those are the major categories of symptoms that we see develop from food allergy.
It can be fairly dangerous too.
Well, food allergies are dangerous. Deaths have been reported from reactions to foods. They're not common, but they do occur.
Well, what are some of the common food allergies? We talked about peanuts, fish, and shellfish. Are there others?
Sometimes spices cause allergic reactions. So I've seen people react to sesame, to cinnamon. Celery is something that you don't see frequently, but is kind of easy to pick up. For instance, I had a girl in the office a couple of months ago who had 2 severe reactions while eating. And we went over the history, and we could not find a common food that she'd eaten. One reaction occurred at the Metrodome, where she had a big cold cut spread, and the other reaction occurred at her grandmother's house on Thanksgiving, so she had, fresh turkey. So we did an allergy test, and we tested her for multiple different foods. The reaction that came up was celery.
So is this something that you can outgrow? I know, a lot of kids, some kids have food allergies. Can they outgrow those? And can adults be treated for them or outgrow them, I guess, too?
The second part of that question, I believe, was can people outgrow food allergy? And the answer to that is yes. But it's variable, okay? And you can't predict which patients will outgrow what reactions. It seems as if peanut and tree nut reactions are infrequently outgrown. And the severity of the initial reaction correlates with how often patients outgrow it, meaning that if somebody had a severe reaction to peanut, it's less likely that they'll outgrow it, and often nut allergy is lifelong. Fish allergy, I know you're a fisherman, and so people who develop fish allergy often have it for a lifetime. Other allergies more commonly are outgrown. I see a lot of kids who had egg and milk allergies as infants and younger children, and then by the age of 5, those allergies resolve. And so it is important to follow patients, and we do retest because we're having kids avoid it. We don't know if they outgrew their particular food allergy, so we need to retest them to see if they did or did not.
Well, summing up here again, if folks think they might be having an allergic reaction to a specific food, what's the first thing they should do then?
Well, the first thing they should do is not eat that food. Okay, and it's funny that, and I have had more than one patient come into the office with a history. Well, I thought I was allergic to a particular food, and I avoided it, but then I just wanted to be sure, so I ate it again, and I ended up in the emergency room. Well, that's not the right way to proceed. The right way to proceed is to come in the office, get tested, speak to your family doc, see what steps need to be done.
All right. Well, all great information. Unfortunately, that's all the time we have. To make an appointment with an allergy appointment with Dr. Alper at Fairmont Medical Center, you can call 507-238-8547 or 800-234-6141. Thanks for joining us today, Dr. Alper, here on Speaking of Health. Great information on food allergies.
Well, thank you.
And thank you for joining us as well, right here on Speaking of Health. Have a great day and be healthy. Now, we'd like to give you a quick update on what's happening at Fairmont Medical Center, part of the Mayo Health System. Fairmont Medical Center is now on Facebook. You can become a Facebook fan of Fairmont Medical Center and check out all of the latest news and events going on at FMC. You can find us on Facebook by logging onto our website, www.fairmontmedicalcenter.org, and clicking on the Find Us on Facebook icon. Thursday, June 25th is a Speaking of Health public program, Food Allergy Facts. Our guest on today's show, board-certified allergist Dr. Barry Alper, will be talking more about food allergies and dissecting the facts from the myths. That's Thursday, June 25th at 7 o'clock in the FMC main classroom. It is a free presentation and registration is not required. There will be door prizes and refreshments will be served starting at 6:30. And we want to remind everyone that Fairmont Medical Center continues to provide free blood pressure screenings to the public as a community service. That's every Wednesday from noon until 1 o'clock in both the Fairmont Hospital lobby and the lobby at the Sherburne Clinic.